A very good evening to all of you. And as we daily do, we come live in front of all of you to discuss any kind of medical concerns that you are having. This live of mine in the evening, the short live for 15 minutes basically, is for all those viewers who are more conversant in English and want to discuss any kind of concerns that they are having, any kind of concerns that they are facing. So my team is just going to be ready for all of you to see any kind of questions that are being posted by you. Till the time I start getting your questions, what I would like to ask you is that if I'm audible to you, if there is no technical problem or something, can you check it out for me, team, please?
Yes.
Is everything going on all right? So that we can then see and we can then ask our viewers.
Yes, you're audible.
Okay, and are the questions visible over here, or do I need to ask questions from you people?
I can make it visible if you want.
No problem. Please help me out with the questions in case we have. I can manage the questions. Please reply me back with any of the questions that are coming your way. So, all of you, please ask any of your questions that you want to ask. You are welcome with your questions and any medical concerns that you are facing now that you and many of our viewers right now who are joining me are facing problems in getting the requisite medicines that you need due to the problem of the lockdown, due to the shipping supplies that have been stopped. Any of my viewers inside India or outside India, if you are facing any kind of problems, please do not worry. You all that you need to do is you need to contact our helplines, you need to contact your coordinator, and then you can request for a one-on-one video consultation with either me or one of our teammates, that is doctors, who can then guide you with certain changed kind of medicine dosage so that you do not finish your medicine stock at before the next medicine stock reaches you. And at the same time, there will be certain dietary guidelines which will be giving you certain yogic exercises and pranayams that we are going to start for you. So you are all requested to ask your questions while I'm live over here. I'll also try to see if any of your questions are there. Please be patient, please be with me while I'm going through the details. If there are any questions, I do not want to miss out on your important questions so that I can reply you with all of your queries. Please be here with me while I'm going through your questions. Please be patient. I'm just trying to check it out. Yes. So I am there and I can see any of your question which comes my way. So if any one of you ask anything, I'll definitely make sure that I am able to reply back to you. So coming back to where I left, that all of you who are taking our medications, whether you are inside India, whether you are outside India, currently due to the episode of this viral infection that has started, many of our patients are facing problems in getting their supplements being shipped to them. In all of those where they are slow to come, you are not getting them properly, do not worry. All that is required from you is you need to request your coordinator to connect you for a one-on-one conference with either me if I'm available or with one of my doctors, who will then see what is the stock of supplements currently left with you, what needs to be changed in the dosage of those supplements so that till the time you can get the next shipment, how to carry on without a break. And at the same time, you will be helped with certain things which will be guided from my end at your own place from your kitchens, which you can take so that even despite taking that lesser dosage of our supplements, your results, your reports still do not deteriorate. And at the same time, another thing which we'll do is that now that you people, many of us are in lockdowns, there will be certain dietary guidelines, and I would request and guide many of you, especially our kidney patients, that in case you are having concerns, in case you are having any problems, what I would personally suggest you that now when we are facing reduced supply of supplements, we need to change certain dietary habits. And what I would prefer is that if possible for you, try connecting to a team so that they can arrange a personalized diet chart for you from our dietitians. Because my slogan for this phase is Ahar, Vihar, Aushad. Ayurveda always says that Ahar, Vihar, and Aushad are really very important. So, what happens over here is when we are talking about Ahar, that means diet. It means that diet is the most essential thing in any kind of treatments. So, now that you are at your place, our specializedly trained Ayurvedic dietitians will plan the dietary regime for you. That is Ahar. Now comes the Vihar. Vihar means what to do, what not to do, how much yoga to do, what kind of yoga to do, what kind of pranayams to do. So, when we are talking about, I would be taking questions later on. So, when we are talking about Vihar, the most important thing in Vihar is that we need to change our lifestyle, because many of these disorders, like renal failure, even then diabetes, then hypertension, and many other chronic ailments. Many of these can be very well managed if we work a bit on our lifestyle. So the basic thing which we are adding nowadays to your lifestyles when you are running short of supplies of supplements is that we are connecting you to expert yoga trainers from the back end. So the first thing which I guided you was ahar, that is diet, and the second thing is vihar, that is the yogic pranayams. Please repeat the question of Mr. Heman Singh.
Himan Singh said, I want to ask you that patient code he has provided. Kamla is her name. She is taking Pentril Plus tetrabenazine tablet, Revacon.
Mr. Heman Singh, all the tablets that you are telling us, all these supplements are basically allopathic supplements, which you are telling us that they are allopathic medicines basically. And since they will be ordered over by 1st April, my sincere advice to you is that right now the allopathic chemist shops are still running, and none of these medicines are in less supply over there. The only medicine which people are facing problem is with hydroxychloroquine, which has been banned by the government for selling, and let it go. So these medicines are easily available. You should purchase these medicines in sufficient quantity, even when we are to taper it down along with our medications. We should be in a position that you have these medicines. So even the gap of half an hour which you are asking about is not required that much. Even if there is no gap between these medicines and our medicines, and both the medicines are taken together, it is not going to cause any kind of problems. But do keep sufficient stock of these medicines with you. So no need to give a half an hour gap. You can have both type of tablets in a single hand, and you can give it to your patient. Rest, let me go through your case and see in details. So once my team will connect to you, and if required we'll be connecting you for a video conferencing, and we'll see what needs to be done. But please do keep these medicines in sufficient stock with you, and no gap is required between these medicines and our medicines. So coming back to ahar, vihar, and third aushad. Ahar, I just told you, is diet, which is very important, which we in this lockdown period are planning by connecting you to expert dietitians who have been working with us since long. Vihar, we have started yoga classes. Don't forget to connect your coordinator and immediately make the patient especially join them for certain pranayams which are good for him. And third, Aushad, the medicine. Now, at some locations in India, we are still able to provide medications to our patients. You can connect to your coordinators, especially in Kolkata, in Bangalore, and in Guwahati, and even in some places in Delhi. Even in Chandigarh, in Amritsar, we are having stocks of medicines and we are able to provide our patients with it. In rest, many places we are not having sufficient stocks of medication. So what we are doing over there is that any patient who connects to us, we simply request that patient to help us out with the mobile number of any medical store near him or any chemist or Ayurvedic store near him which can provide the patient with the required the guided medications, and then when we connect to that chemist we see what kind of medications he or she is having, are any Ayurvedic medications of any other company available with them, and if they are available we immediately guide our patients with those medicines. Definitely, we have more faith on the quality of our medicines of our company. But right now, in this phase when we are not getting sufficient medicine supplies, what is important is not to break the medicine dosage, even if we have to take it of some other company. So we will be guiding you. Definitely, Himan Singh ji, there are many side effects of those medicines, but I'll have to plan tapering down those medicines after going through the complete signs and symptoms. I'll have to go through a thorough analysis. I do not want to rush with removal of these medicines because the withdrawal side effects of many of these medicines are multiple. So it becomes very important for us that we plan it out. We do not immediately stop all of these medicines. So that is the answer to your question, and I would like to thank all of you for joining us today for this short session where we generally there is one more question, Mr. Suvidhams. Can you please repeat this question? Patient ID is 3448882.
He's an existing patient. He's saying patient legs are swelling off and on. How to solve this?
See, the best method for that is that please help us out with the urine output and the liquid intake. We need to see how much urine is being passed out in 24 hours and how much liquid is being given. And you have also helped us out with your patient ID. My team will definitely analyze the things and see what needs to be done. If possible for you, also go for a serum protein check, because maybe the protein level is less. That is also something which causes swelling in the patients. So help us out with these levels, and do remember to check the 24-hour urine output and the liquid intake, so that tomorrow when you are again here with us for the live, there is no problem in discussing the things and we really know the answer to your question. So do check those levels and revert to us. So I would like to thank all of you for joining us today for this brief session, which is basically meant for taking the questions of those patients who are there with us, who are taking treatments with us, but are more conversant in English. So any of your friends, any of the patients who are taking treatments from us, you are welcome to join daily. Till the time we are in lockdown, you are facing problems, I'll be helping you out through these sessions up to my level best.
Himanji has asked another question. He is saying we are giving that allopathic medicine at morning and at afternoon too, but that have been closed from last 1 week, and we are thinking to close this till 1st April.
No, Himanji, I personally do not feel that we should rush with closing these medicines so quickly, because once you close all these medicines, the side effects won't be an immediate side effects. After approximately stopping these medicines from 14-15 days, if we withdraw them so quickly, the patient will face side effects. So do not stop them like this. Let us discuss the case. Contact my team. Let me see. They have to be planned very nicely, and one by one we have to withdraw them. Not like this. It can cause problems. So for all of you, stay blessed, stay safe, stay in your homes. Please try avoiding going out.